I want to welcome you to our website, and specifically the section on functional medicine. Today we're going to discuss functional medicine, the 21st approach, and 8 absolute essentials to great health. Functional medicine is a 21st century approach to evaluating and managing the chronic patient. It is based upon identifying the underlying cause of the disease or the chronic pain, rather than just treat the symptoms. Functional medicine incorporates a whole body approach with emphasis on dietary and lifestyle changes. Through careful analysis of genetic influences, environmental factors such as toxic exposure and dietary habits, we can begin to identify the complex web of chronic disease and illness. This very scientific approach and analysis incorporates both the actual art and science of medicine. It is important to remember every patient is unique and the cause and support recommendations will be slightly varied. We see many people in our office with chronic health-related issues: neuropathy, stenosis, rheumatoid arthritis, fibromyalgia, diabetes, Hashimoto's, and complex regional pain syndrome. What I have found over the years is what my patients really want are the answers to 2 basic questions. Why do I have this condition, and what can be done to get my health back? Health can be defined as the optimal state of well-being, not just the absence of disease. Our current healthcare system, more accurately, should be called disease care. It focuses on symptoms, not causes, and it is a reactive model based on the magic potion or magic bullet approach. It is pharmaceutically driven. For optimum health, there are 8 essentials that we'll be discussing in this video. I am curious as to how many you are doing. The first, we must control inflammation. It is our body's response to an unhealthy environment. It could be acute from an infection or a trauma, and this response is beneficial to the body, or it could be chronic, such as long-term infection or an increased stress response. This situation over time is not healthy for the body. Our immune system is set up so when we are exposed to any toxin or foreign agent, it tags it so the next time we are exposed, our immune system can deal with it in a more efficient, timely manner. However, at times our immune system gets out of balance and it can actually begin to attack our own tissue, resulting in an autoimmune situation or a heightened immune response. Chronic inflammation is not beneficial. The immune system is primarily located in the gut, approximately 70 to 80%. The remaining 20 to 30% is in the skin, lungs, and mucous membranes. The brain basically has its own immune system. If your body is in a state of inflammation, it will not be able to repair itself. The gut is where 70 to 80% of your immune system resides. Hippocrates, the father of medicine, states, all disease processes begin in the gut. Some common causes of inflammation of the gut are poor gut flora, hidden gut infections, food sensitivities, inflammatory foods, and leaky gut syndrome. Some other causes are poor omega-3 to omega-6 ratios, high blood sugar, autoimmune disease, joint misalignments, joint destruction is a chronic local immune response to inflammation. It is important that you properly diagnose and manage the cause of inflammation and not suppress the immune response with anti-inflammatory medicines. The second essential factor in optimum health is proper digestion. If we do not absorb our food properly, we cannot convert it to energy. Hypochlorhydria is the most common reason why we have poor digestion. There is not enough stomach acid to break down the food. We believe supplementing with HCl is one of the most significant measures you can take to restore your health. Along with proper stomach acid, we need proper functioning of the liver, gallbladder, and pancreas. We need to have proper gut motility, which is controlled by the brainstem and more specifically the vagus nerve. This is the cranial nerve responsible for rest and digest. If we are in an overly stressed and our bodies are in a fight or flight mode, an increase in sympathetic tone will affect the parasympathetic nerve, resulting in slower gut motility, or constipation. The third essential component for good health is proper cellular uptake of nutrients and macronutrients. We need to be able to absorb fatty acids, amino acids, and glucose. There are two major factors in this process. Insulin is inflammatory and will make the receptor sites more resistant. And secondly, there must be a proper acid-alkaline balance. Our standard American diet tends to be more acidic. We would like to see the pH 6.4 to 7.0. Diet is critical in controlling high blood sugar and insulin levels. It is important to eat protein-based meals, limit the amount of carbohydrates, exercise a minimum of 20 minutes per day. If you eat a meal and are tired after the meal, that is a sign of insulin resistance. The fourth essential component to health is we must be able to convert the macronutrients to energy inside the cell. The energy factory of the cell is called the mitochondria. This requires many vitamins and nutrients. If you are not eating properly balanced meals, you could be deficient in some of these nutrients. Sometimes there are genetic deficiencies that you can overcome through proper supplementation, which makes it difficult to convert energy within the cell. The fifth essential component to great health is proper elimination. The byproduct of energy metabolism must be eliminated. Poor metabolism means more fumes or more free radicals. Free radicals will destroy your mitochondria and your ability to produce energy. Premature aging or fatigue are common signs of this. Glutathione is the body's major antioxidant. Its job is a free radical scavenger and to reduce the amount of oxidative stress. For proper elimination, we need phase 1 and phase 2 of the liver detoxification cycle to function properly, along with the kidneys, lungs, skin, and gut motility. Exercise is also very important in proper elimination as it lights up your brain more than anything, improves cellular uptake of nutrients by decreasing insulin levels, and it gives you more energy as well as fat loss, and it leads to weight loss. So how much exercise should we do? 20 to 30 minutes per day is a good target exercise range. We want to keep our target heart rate 180 minus our age. Resistance training should be done 2 to 4 times per week. By adding 1 pound of muscle to your body, you can burn 5.2 pounds of fat. The seventh essential component to good health is proper sleep. We need 6 to 8 hours of continuous sleep. If sleep gets interrupted, look at hormonal issues, blood sugar issues, or an unbalanced autonomic nervous system. Sleep apnea is a classic symptom of poor brainstem function at the medulla oblongata. It can be greatly improved with brain-based therapy. Hypertension is another sign associated with brainstem dysfunction and is oftentimes seen with sleep apnea. The eighth essential component is proper brain function. The brain is an energy hog. 30% of our energy and oxygen go to the brain. All metabolic conditions will affect the brain. 70% of our brain is a brake pedal. It regulates the autonomic nervous system, bodily functions that we really don't think about, such as digestion, heart rate, respiration. It also inhibits the limbic brain or our emotional brain. The autonomic nervous system is a balance between our parasympathetics, or rest and digest, and sympathetics, our fight or flight. Which one of these two operate most of the time? Well, the answer is the parasympathetics. We only need our sympathetics when we are in true fight or flight mode. Therefore, it needs a brake on it most of the day to control it. This is done by our upper brain, the frontal lobe, and the basal ganglia. When they fatigue or do not regulate properly, we lose our brake pedal or our inhibition. Thus, this leads to a sympathetic escape when the braking or inhibiting mechanism begins to fatigue. Symptoms can include migraines, chronic pain, fibromyalgia, blurred vision, insomnia, dry eyes or mouth, decreased digestive enzymes, constipation, acid reflux, cold hands and feet, increased sweating or urination, high blood pressure, and vertigo and balance disorders. When we get a limbic escape, we can have difficulty focusing or have symptoms of depression, irritability, anxiety, brain fog, just can't enjoy life, disorganized thinking, such as guilty, paranoid, or not feeling loved. The good news is the brain can be changed. It requires fuel and activation. Fuel in the form of glucose and oxygen to decrease the inflammation, and activation in the form of brain exercise to control the sympathetic or limbic escape. It is important to treat the patient from a neurological and metabolic standpoint to achieve results. I want to add that proper testing is very important when discovering the cause of the underlying problems. We perform a comprehensive orthopedic, neurologic, and metabolic examination, and will recommend lab tests when necessary to identify the true cause of the problem. Ask yourself the following: do I truly believe I can be healthy? Do I deserve to be healthy? Do I care enough about myself to make the necessary changes to be healthy? If you are looking for a better life, our health is our greatest asset. Functional medicine and neurology is the only type of care that will get the chronically sick better. Thank you for listening. If you have any questions, email me at drveselak@gmail.com. Our website is drmichaelveselak.com, and our Facebook page is Camarillo Functional Health. We look forward to seeing you. Call for an appointment at 805-482-0723. Thank you for listening.